Well, thank you all very much. It's a great pleasure to be here. Lord Mayor, distinguished guests and health heroes. I guess a lot of you will be wondering who the hell I am. I used to be the chairman of a health authority, and I used to be the chairman of an NHS Trust. So I'm a kind of professional has-been that comes on to get you all going before I was outside talking to someone, and they just said to me, "Are you here for the health thing?" And I said, "Yes, I am." She said, "I thought I recognised you. Didn't you used to be somebody?" Which was, I thought which was a great start. Listen, I want you to help me here. I want you to remember a number for me. I want you to remember the number 98, okay? Can you remember that for me? 98, we say yes, Roy? Yes, so thank you very much. Okay. I'm really nervous about speaking here tonight because I know that I'm in a room of experts. I've met an ambulance expert. I've met my new friends from the coding department. Where are the coding ladies? Give us a wave. Give the coders a round of applause. I think that's terrific. They are the new engine room of the NHS, and I met the healthcare infection ladies. Where are they? Oh, they've gone to wash their hands. Okay, that's all right. Fine. I feel a bit like Albert Einstein. Really, there's a wonderful story about Einstein about talking to experts, and Einstein, of course, came up with the theory of relativity: E equals mc squared. And when he did it in the 1920s, there was no prescient media like there is now. Very few people read a newspaper. There was no radio. And so he used to give lectures in halls rather like this about E equals mc squared, the theory of relativity. And he went on a coast-to-coast tour in America talking about his theory. And, of course, no one knew who he was. And he was driven coast-to-coast by car by a chauffeur. Halfway across America, he said to the chauffeur, "You know, you must be fed up with listening to the same lecture every night." And the chauffeur said, "Well, I'm not fed up with it." He said, "But I think I know it off by heart." And Einstein said, "Well, I'm fed up with it. Tonight we'll swap. You do the lecture, I'll do the driving." So they went to the campus. No one knew who Einstein was, so they welcomed Einstein's chauffeur. Didn't know the difference. Einstein was there dressed as the chauffeur. Einstein's chauffeur stood at the lectern rather like this and delivered Einstein's theory of relativity flawlessly. And it was all going so terribly well until question time. And someone stood up at the back and asked some god-awful question about the weight of matter. Unfazed, Einstein's chauffeur rounded on the question and said, "I can't believe my having delivered such an erudite lecture you could ask me such a stupid question. Why, even my chauffeur knows the answer." Do you know, I think it's right tonight, here talking about health heroes, that we should remember just for one moment one of my favourite heroes of the NHS, and that's Claire Rayner. Dear Claire, I was the spokesman for a while for the Patients Association when it first started. She was a wonderful woman. She said, "You can be our spokesman, but there's no money in it." Which was typical of Claire. I did a Channel 4 debate with her, and we all had to stand up and say something stupid, and we were sitting rather like the front row sitting there, and we had to get up and come to the podium and say our thing. And Claire hadn't been very well, and it was a real palaver for her to get up and come to the podium. And the director said, "Are you sure, Claire, you want to do this? Because we can film you from there." And she said, "No," she said, "the NHS didn't spend all that money on me so I could sit on my arse," which I thought was a wonderful Claire Rayner. But, of course, it's said that her dying words were, "Tell David Cameron, if you screw up the NHS, I'll come back and haunt you," which is very Claire Rayner. And I guess it kind of hits the spot, doesn't it, here tonight. I was born before the NHS started. My dad was a window cleaner. My mum was a shop worker. I was born in a single room in the East End of London. And my dad had to save up the equivalent of 3 weeks' wages in order to get a midwife to come and deliver me. My mum had lost her first baby, so these days it's what we call a woman at risk. There's no prospect of my going to hospital or my mum going to hospital. My mum nearly died when she had me. She was 12 hours in labour. She said it was worth every minute. I can understand that. But of course it was a defining moment on the 5th of July 1948 when the then Labour government put into effect the beverage reforms, started by a coalition government, of course, and the NHS was born. And it took off the shoulders of an exhausted Britain and its working classes the worry of illness and accident and injury at work and so on. And how little did I know that years later I would end up running a health authority, and I started my career in the NHS in 1974. And I've seen 6 major reorganisations and 17 secretaries of state. But I think we might get it right soon. I don't know, anyway. But the jokes have changed. I remember there was a time when we tell the joke about the guy going into McDonald's and standing in a queue and saying to the girl, could I have a hip operation, please? And she said, we don't do hip operations. He said, I know that, but I only had to wait 3 minutes in a queue before being told I couldn't have what I wanted. And things have moved on a lot since then. My mum actually couldn't believe when she came to have her cataracts done that she only had to wait three weeks for the operation. And she was 3 months when she got the second one done. She was convinced that I'd actually paid for it. She wouldn't believe that it was that quick. So the NHS has made huge strides and huge changes. And now, of course, we're facing the uncertainties of another reorganisation, which I know a lot of you will be concerned about. There are issues about jobs in the future and all the rest of it. And, you know, I don't know, really, tonight's not the night for controversy, but it is a risk. I mean, there's something to be said about holding GPs' feet to the fire on commissioning and make sure that they understand the costs that they're incurring and to make sure that they're acting in our best interest. But I'm also kind of worried that they're going to make decisions about money and not worried about me. And to paraphrase a famous astronaut, I don't really want to be on the operating table thinking that my cardiothoracic bypass surgery is going to be carried out by the organisation that bid the least to do it. So we do have some serious things, I think, to think about, but tonight is not the night for that. Tonight is to celebrate heroics in the NHS and its successes. And, you know, all those reorganisations that I've seen, all the changes that I've seen, they've all worked. No matter who put them in place or how daft they were, they've all worked. And they haven't worked because the plans were right or the politics were right. They worked because you were right. Because the staff on the ground, the patient-facing staff, the coal-face staff, they make it work. You are the people that have made it work. And you'll make this one work as well, of that I'm sure. It's because of your talent and your commitment, sense of vocation, enthusiasm, common sense, that you will make whatever the politicians throw at us work. And I asked you, didn't I, just to remember a number. What was the number? 98. Good. I want you to do something for me, because 98 is the latest figures that we have from the Department of Health press office. 98 is 98%, actually. There's a 98% approval rating for the NHS. And I think that's a fantastic figure. And I think there are a lot of private companies that would be very pleased to have that level of success as well. So I want you to do something for me. Would you all stand up, please? Would you stand up? Would you face that way and pat the person on the back in front of you and say, well done and thanks very much. Thank you all very much. Have a great night. You're all heroes. Thank you very much.